everyone.
Hi.
Annie and Sidney here for Dietitian Talk. Have a lot of questions as to why we recommend taking the calcium supplements after surgery. Mm-hmm. And so 3 points in the beginning. You are going to be having less intake of dietary calcium after surgery just because you have less intake of everything. Mm-hmm. So that's one thing. Also a little bit risk of higher malabsorption after surgery, so that's another reason. There's also some rapid weight loss can sometimes leach calcium out of the bones, and so that's another reason why the calcium is recommended after surgery. A lot of people tell me, well, I had my serum levels checked and my calcium was normal, so do I really need to be taking the calcium? A good thing to be aware of is that your serum calcium doesn't always reflect your bone health. Your parathyroid hormone will actually break down the bones to raise the serum calcium. So just keep that in mind. If you have questions about whether or not you should take the calcium, feel free to follow up with your primary care provider about that. And just know that bone density scans are a better way of actually reflecting your bone health.
And if you were told not to take calcium at some point, obviously listen to your primary care. And we just recommend getting follow-ups as regularly as possible for that. Calcium, why it's also important in health, it is good for bone and teeth health. It is important for muscle function. It helps with our cardiovascular health. And also our intestinal health. So lots of good benefits. So that's why we recommend calcium after bariatric surgery.
Yeah.
Awesome. If you have any other questions, feel free to reach out.